All right. Let's start this presentation with a pop quiz just to give us a bit of context before we start to talk about cervical cancer and HPV, the virus that causes cervical cancer in women. How many people do you think died in 1945 from the nuclear bombs dropped on Hiroshima and Nagasaki during World War II? The answer is 220,000 people died. It's estimated that 220,000 people died in Japan in those two cities in World War II. Now, how many people, how many women specifically die from cervical cancer each year? The answer is 348,000 women, based on data from 2022. About 348,000 women globally die from cervical cancer. That is 1.5 times the number of people that died during the atomic bomb drops in Hiroshima and Nagasaki. What this means, just for context, is that death from cervical cancer is at the scale of a 1945 caliber nuclear bomb being dropped on women globally every single year. That should cause us to just be alarmed. And as humanitarians, it should cause us to actually act. So I wanted to give you that context and background before we talk about the proposed roadmap for HPV VIG submission to Gavi. VIG stands for Vaccines Introductions Grant. So Gavi is going to provide funding to the government of Papua New Guinea to introduce this HPV vaccine in Papua New Guinea. But of course, there's a process. That's the process that I wanted us to go through. So how I've structured this presentation is I'll walk you through a brief understanding of the problem so that you know what the issues are. And then I'll walk you through the proposed solution. And then we'll also discuss some of the next steps in terms of like the work plan that I proposed, let's say, to Chai, who are leading this particular engagement and just brought me in as a consultant to support them because of my previous experience working with Gavi. All right, so let's dive in into understanding the problem. So in 2022, it's estimated and forecasted that 348,000 women died from cervical cancer globally. And more than half of these deaths actually occurred in the Asia-Pacific region. In the Asia Pacific region, about 56 women, or about 56%, 56% of the global total of women who died from cervical cancer occurred in the Asia Pacific region. That's a huge proportion of women dying. Of course, there are many more people in that part of the world, but at the same time, if we zoom in to PNG specifically, Papua New Guinea, which is part of the Asia Pacific region, has the second highest age standardized cervical cancer mortality rate, meaning that for every 100,000 women, about 20 of them die from cervical cancer every single year. Of course, it's worse in Fiji, as you can see from that chart, but it's also not very different from the women in Papua New Guinea. But Fiji, the difference is Fiji actually has the HPV vaccination program. So at least they are making efforts to vaccinate these women. But Papua New Guinea currently doesn't have a government-owned, government-funded HPV program. Now, of all the tools that are available to us to address this problem, the most powerful tool is vaccination, immunization. And this is a tool that can definitely help reduce the number of cervical cancer deaths in Papua New Guinea, because it's a primary preventive care tool. When it comes to primary health care and prevention, which is obviously always better than cure, vaccination is the most powerful tool that's available to us. And based on some reports from Gavi, HPV vaccination specifically translates to about 17.4 deaths prevented per 1,000 girls vaccinated. And of course, also, I think you might be wondering, why are we focusing on girls? Yeah, it's because this is cancer of the cervix, and cervix is mostly in women. So it's cervical cancer. But also, it's sexually transmitted, right? And the target group is actually girls who are 9 to 14, because by 15, girls start having sex. So you need to target them before their first sexual debut, right? That's just a bit of context. So why should we act now? There are three reasons, right? The first reason is that PNG is one of the remaining 6 countries in the Western Asia Pacific region without a HPV vaccination program, government funded. Of course, there's some HPV vaccines in the private sector, which is always the case in most countries because there is the private sector demand. But in the public sector, there's nothing. Okay. Also, the second reason why we should act now is because the funding has an end date. So PNG is among a group of countries eligible for Gavi funding support towards introducing HPV vaccines. However, this eligibility period will end in 2027, 2 years from now. So they have to, if they want this basically free money to introduce HPV vaccines, they have to apply over the next 2 years. So they made the decision to apply in 2025, right? Also, Gavi recommends that countries plan a lead time of about 15 to 18 months for the application submission, so that there's enough time for Gavi to review the work plan, provide feedback, you revise it, etc. Then you actually spend some time, like a year even, preparing for the initial HPV launch in your country, right? So that's why we have to act now. The other reason why we have to act now is because HPV vaccine, like I mentioned already, translates to about 17.4 deaths averted per 1,000 women vaccinated or girls vaccinated. What this means for PNG, I did some forecasting and predictive analysis. But what this means for PNG is that about 100,000 lives could be saved between 2026, when the HPV vaccine is launched, and 2070. That's 100,000 women, sisters, daughters who don't have to die over this 44-year period. And that's impact, and that's value, human value. So we should not miss the chance to introduce HPV vaccines in Papua New Guinea. So what's the proposed plan? What's the proposed solution? What's the way forward? So clearly, our overall objective is to identify eligible girls who are usually 9 to 14 who have not yet received HPV vaccinations, and then develop a clear strategy to reach them in a sustainable way so that we can avert this death from cervical cancer in PNG, right? So the first question we have to ask ourselves is, how many eligible girls are in PNG and how can they be reached? So there are 3 ways we can start the process of reaching these girls. One, we have to first map the size of the target population. We have to look at various data sources, be it census data, be it UN data, be it other private sector sources, and triangulate all these different sources to get a fairly good estimate or forecast of how many or what the market size is, essentially, as consultants would say. Then we have to quantify this and also break it down, let's say, by province, by district, so that we know how many resources are going to be needed to reach these girls. And also help us to like prioritize. Yeah. That's the first step. That's the first sub-objective of the main objective. Then second, we have to identify the barriers to immunization, the barriers to reaching these girls. Are there social, cultural, and even political barriers? Yeah. Are there barriers on the service delivery side, on the demand generation side? We have to really map those out extremely well, right? And then do a qualitative gap analysis so that we know, okay, these are the problems, develop some kind of problem tree, and then also based off of that, develop a solutions tree, a hypothesis tree about solving each of these specific problems that we have identified. Yeah. And then last but not least, development of the plan itself, this development of a strategic implementation plan. Yeah. On how we're going to sustainably reach these girls over the long term. Yeah. All right. This will involve identification of what are the levers. What can we leverage? Can we leverage people? Can we leverage processes? Can we leverage technologies to gather data? You know. And then obviously, all this will go into the proposal that we eventually submit to Gavi. Yeah. We also need to obviously include a monitoring, evaluation, and learning plan. Okay, so this is actually the three-phased approach, broken down differently in terms of activities and the specific deliverables. I won't go through it again because I've already kind of hit on them before. And then this is now obviously the Gantt chart showing that the target date for submission is 16th of September. Right? So Ben, where I want you to come in is actually on that first phase, the scoping phase and the quantitative analysis, where we are sizing up the market, right? Because we want to be sure how many girls are eligible for this HPV vaccine. So I'm going to share with you some reports and data that they've already sent with me. Then I hope you can actually just develop like a non-market size, population size model to quantify, okay, how many girls are 9 to 14 years old, let's say, in this province or the other province, right? Yeah. And then, yeah, that's the end of the presentation. But it's only the beginning for how many lives can be potentially saved in PNG when we introduce the HPV vaccine in 2026. But of course, the process starts now in 2025 with the application submission to Gavi, and we can take it from there.